Yes, if you look at the question, it's asking about the segments of the aorta. It mentions the left subclavian artery and the ligamentum arteriosum, which in Korean is called the ductus arteriosus ligament. The question is asking about the segment of the aorta located between these two. The correct answer is D. You can see that the aortic isthmus is the area in question here. If you look at the diagram, you can see the branches of the aorta. First, the brachiocephalic artery branches off, followed by the left common carotid, and then the subclavian artery. Starting from here, the area located between this point and the region where the ligamentum arteriosum is found is called the aortic isthmus. Since this isn't a difficult topic, you just need to review the basic terminology along with the diagram. As I've emphasized several times, when studying the heart section, it's important to have an anatomical understanding of the aorta as well. So please refer to this information as you study. Let's move on and look at the next question. This question is asking about the location of the expanded area behind the aortic valve. If you look for the correct answer, you should choose the sinus of Valsalva, which is listed as option D. As you can see in the diagram, there is the aortic valve, and the area that bulges out behind it is called the sinus of Valsalva. Next, the area connecting to the ascending side in the middle here is called the sinotubular junction. Usually when it comes to the aortic valve, not only the anatomical structures here, but also the connected Valsalva sinus, the sinotubular junction, and even the ascending aorta are often covered in detail. So when you study this part, it's a good idea to break it down further and familiarize yourself with each of the specific names as well. Let's look at the next question. It's asking for the most likely explanation when there is dilation or expansion of the main pulmonary artery. This question is asking about the common causes of pulmonary artery dilation. Among the choices, you should select option C as the correct answer. If there is pulmonary hypertension, the blood vessels will expand accordingly. As a result, pulmonary artery dilation can occur. First, in the case of a bicuspid aortic valve, it is a disease where the aortic valve, which should normally have 3 cusps, has only 2 cusps. As for truncus arteriosus, which is option B, I will provide additional explanations while looking at the images. If you look at the diagram, in a normal heart structure, the left ventricle is connected to the aorta, and the right ventricle is connected to the pulmonary artery. A disease in which the blood vessels do not split into 2 but instead form a single vessel is called truncus arteriosus. This condition can be considered a rare congenital heart defect. In cases with this disease, because high-pressure blood flows into the pulmonary artery, over time the pulmonary artery may become dilated. However, since the question is asking for the most likely and more commonly encountered answer, you should consider pulmonary hypertension as the correct answer. As for truncus arteriosus, you can just keep it in mind as a reference. Let's move on to the next question. We're trying to distinguish between the coronary sinus and the descending aorta using pulse wave Doppler. In the case of the coronary sinus, the blood flow is prominent during diastole, whereas for the aorta, this question is asking at which timing the blood flow is most prominent. It's a simple pattern. For coronary circulation, it appears during diastole. For the aorta, as we generally know, the waveform is most prominent during systole. So the correct answer would be to choose option D. So, through this question, remember that coronary circulation occurs during diastole, while general aortic circulation occurs during systole. Make sure to distinguish between the two. If you watch the video, you'll see that blood gathers in the coronary sinus through the coronary veins. Additionally, keep in mind that the blood that gathers like this flows into the right atrium. If you look at the parasternal long axis image next to it, you'll see the coronary sinus at the bottom. And next to it, there is the descending aorta. If there is a disease and the size of the coronary sinus increases, then it becomes necessary to distinguish between this structure and the descending aorta. In such cases, as explained in the previous question, you can use pulse Doppler to determine whether the prominence occurs during diastole or systole, and thus evaluate the 2 vessels. Let's move on and look at the next topic. The question is asking about the area that is not supplied by the left anterior descending coronary artery. For those who have studied the basic coronary segments, I think you will be able to find the correct answer without much difficulty. For example, the inferior wall of the left ventricle, as in option D, receives its blood supply from the right coronary artery. So for the unrelated answer, you should choose option D. You can also organize your understanding through the question by noting that options A to C are the relevant choices. That concludes our review of this question. Next time, we will continue with the following content. See you in the next session. Thank you.